The number of people killed each year in the United States from opioid overdoses is at an all-time high. Commonly abused opioids include prescription painkillers such as Vicodin, Percocet, and OxyContin.
Opioid abuse is a real public health concern and a major problem for Medicare. The amount that Medicare pays for commonly abused opioids is drastically increasing each year. In fact, in 2014, we paid almost $4 billion for commonly abused opioids.
Medicare is paying for an increasing number of opioids, and that creates a challenge for the program.
It's very important that Medicare only pay for necessary drugs. Unnecessary or unused drugs can end up on the streets.
OIG has seen cases where doctors prescribe unnecessary drugs and cases where patients move from doctor to doctor to get as many prescriptions as possible. In the end, Medicare pays for unnecessary drugs and makes this problem worse, and the concern is not limited to opioids.
The OIG is actually seeing a dangerous trend of people combining opioids with other medications like HIV drugs and antipsychotic drugs in order to increase their high. Although this may feel good, it actually increases the chances of an overdose and can have devastating consequences. We've done work to identify Medicare patients who were at risk. In one example, we found a Medicare patient who had received HIV drugs from 16 different doctors and filled those drugs at 28 different pharmacies in just 1 year. Receiving so many drugs from different doctors is very dangerous for the patient and can mean that unnecessary drugs end up on the street.
This is a multifaceted problem. OIG has made many recommendations to Medicare, including expanding monitoring of drugs prone to abuse, like HIV drugs. It currently monitors opioids. Another recommendation is to restrict at-risk patients to a limited number of pharmacies or prescribers, while also assuring continued access to medications for people with chronic pain conditions.
Expanding the monitoring program and restricting certain beneficiaries could help to reduce drug abuse and overdoses. It could also save taxpayer dollars and save lives.